Hello, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Today, I would like to tell you about blocked fallopian tubes. Would a surgery help you, and what are your chances of success after you get a surgery done? So let's try to understand what blocked fallopian tubules are. Before that, we'll see what is the role of tube actually. So a tube is connected to the ovary where the eggs are growing, and once the egg is released, the tube catches the eggs from egg that is released from the ovary, and with finger leg projections it is pushing the egg towards the tube. So now there are two tubes and they are connected to two ovaries, and the egg could be released on either side. Remember what I told you, there are finger leg projections, and this is how it looks inside the tube as well. So the egg rolls over it, and with these finger leg projections it gets the movement with the fluid inside it. So it's very critical that this environment be maintained inside the tube. Now a tube could be blocked maybe because of a previous surgery, previous ectopic pregnancy, or maybe some infection that you had, maybe a tuberculosis. It could also be because of endometriosis. So any scarring which is present inside the tube can cause tubal blockage, and many women with tubal blockage have known to suffer from ectopic pregnancy. That's because the egg is getting fertilized there, but it's unable to come into the uterus to implant. So this is a very common problem with people with blocked tubes. Now if both the tubes are blocked, then the chance of success is almost equal to zero, isn't it? Because the tube is blocked, and the egg, even if it is released and it is fertilized as well, it cannot travel back into the uterus to implant and become a fetus. So that's the problem with blocked tubes. Now how do we treat blocked tubes? Basically it can be treated with surgery through laparoscopy. These blocked tubes can be opened, but depends on the scarring. If it is very severe, if it is in various stages, if it is depends on the position of the blockage, all these make the success of the surgery which helps in opening the block. Sometimes these blockages are bypassed and holes are made on the other side, but everything, like I said, depends on the stage of scarring and the stage of blockages that have damaged the tubes. Now can you get pregnant with blocked tubes? Now if only one side is blocked, then the other side which is open can still be utilized for treatment. What you could do is, if you're ovulating on that side, you can get your ultrasonography done, confirm that the ovulation is happening on the tube on the side that is open, and try for pregnancy. So this definitely can happen. Unfortunately, when both the sides are blocked, you cannot try naturally, and the only way for you, which is a very good way and your success rate improves, is IVF, that is in vitro fertilization, or ART, assisted reproductive technologies as we call it. So that is a very good way of trying to conceive and improving your chance of success. If you have been diagnosed with blocked tubes, if you would like to understand more about this, please call us on the numbers that you see on the screen. Thank you.